So VBACs are vaginal birth after cesarean section. So we often, in just the GYN world, refer to things like a TOLAC, or trial of labor after C-section, which is the attempt or the goal for the VBAC, or the vaginal birth after C-section. A VBAC can be done in certain populations, and many women are actually candidates for a VBAC if they choose to. Not all women choose to have a VBAC, and that is absolutely okay. You can elect to have another C-section in the future, usually after 2 or 3 C-sections, depending on the patient population. We do recommend future C-sections. But for some women, they really want that opportunity to have that vaginal birth after C-section. For example, a patient who had a C-section for the first baby because the baby was breech, we don't ever know that she couldn't have labored on her own and had a vaginal delivery. And so this is an opportunity to have a discussion about what is important. It's also a chance for somebody who's had 4 babies and the first 3 were vaginal and the last one was a C-section and wants a chance to have a vaginal delivery again. This is a patient who's an excellent candidate for a TOLAC or VBAC. VBAC does have a risk associated with it. The risk that we worry most about is risk for uterine rupture, which is where that scar is along the uterus, particularly when it comes to the labor and pushing part, because it's the thinnest part and we worry about risk for rupture. Rupture is when that spot opens up, which occurs in less than 1% of the appropriate candidates for VBAC or TOLAC. But that is an emergency that we would want to be able to rush and do a C-section for.